With the added pressures of COVID-19 over the last 2 years, there's been a growing backlog of surgeries in the province.
And it's something local hospitals will be trying to tackle in the months to come. In part 2 of our series, Your Road Ahead, Nicole Martin goes inside Joseph Brant Hospital to learn more about the future of our healthcare system.
At the start of the pandemic, people cheered from their balconies and honked their horns, all to support healthcare workers on the front lines. But into the third year of the pandemic, all across Ontario, they're still caring for severely ill COVID-19 patients.
Nurses have been over 2 years already, not taking vacations, canceling, giving days off.
The Registered Nurses Association saying healthcare workers remain in overdrive.
COVID is not done with us.
Many surgeries came to a halt as ICU beds were over capacity.
But now hospitals like Joseph Brant in Burlington are ramping up to get patients who have been waiting back in the operating room.
Dr. Ian Pereira is the hospital's chief of staff and gave CHCH a look inside the intensive care unit for the first time since the start of the pandemic.
We are in an ICU room at Joseph Brant Hospital, and I think this is one of the first ICU rooms I've seen empty in 2 years.
Dr. Pereira says it won't be empty for long.
COVID has placed an unprecedented pressure on the intensive care units across Ontario and really showed how short we were of this important resource as a province.
He says it takes more than an ICU bed to resume surgeries.
More importantly, it's the staff, it's the nurses, and that's where we're really short.
Hamilton Health Sciences has an estimated backlog of 8,085 surgeries. There are another 6,500 in the queue at St. Joe's.
We've been working nonstop for 2 years on COVID, and I think now we really need to entertain a pause, get our feet under us, and concentrate on clearing this huge backlog of surgical cases that's causing a great degree of suffering for the community.
When it comes to hospital protocols, the medical director of infection control at HHS says despite future mask mandate changes in this province, the public health measures should remain in place within the hospital setting.
Looking globally, what happened in the jurisdictions that lifted mask mandates in the community, healthcare is typically excluded from that.
Dr. Dominic Mertz says the advice for patients has remained the same. See your doctor or go to the hospital if an issue arises.
Lots of things have accumulated because people didn't seek medical attention, which wasn't to their benefit.
What message do you have to some of the people living in the area, potential patients that maybe need to come in for procedures or appointments?
Yeah, so this is a really easy one. The hospital is safe. The emergency department is safe.
And Dr. Pereira says they are prepared for anything to come. Looking at Your Road Ahead, Nicole Martin, CHCH News.